Half the Sky presentation by Patrick, Caitlin, Becky, Kyle, Rebecca, and Jasmine.
Before we begin, I must advise you that this content is disturbing and will draw out strong emotions. If you do not want to hear about forced prostitution, child rape, unlawful imprisonment, and violence, please turn off this recording. To set the tone for this presentation, I'll give a small synopsis of Sray Rath's experience. She's one of the many girls discussed in this book. Rath and her family were poor Cambodians who ran out of money when she was just a young teenager. A local labor broker engaged Rath and her family about an opportunity to wash dishes for a restaurant in nearby Malaysia. This individual assured the family she would remain safe, have a steady paycheck, and be housed with several other girls from neighboring villages. Upon transport, and soon after crossing the Cambodian-Malaysian border, the girls were handed over to criminals who took them to a karaoke bar that also operated as a brothel. Rath was beaten, gang-raped, and drugged repeatedly until she complied with her captor's wishes. She was kept naked to mitigate her attempts to escape or hide tips from her clients. She was forced to work in this environment for 15 hours per day, 7 days per week. After months of this abuse, she escaped to a Malaysian police station and told the authorities what had happened. Instead of assistance, she was incarcerated for 1 year due to her status as an illegal immigrant. Upon her release, she was entrusted to a Malaysian police officer who transported her back to Cambodia. After crossing the border, he promptly sold her to another sex trafficker. She was forced to work in a brothel for several more months before her escape. She eventually found her way home and connected with an international social worker who gave her a small business loan. Rath began a successful small business selling snacks and souvenirs. Rath's story is tragic and unimaginable to most people in developed countries. Unfortunately, her story is all too common for millions of young women worldwide. Humankind's penchant for violence directed at other living beings is unrivaled. Throughout our history, the vast burden of this violence has been directed towards women. Small, cowardly, and inadequate men have exacted calculated and shameful evils against women under the guise of culture or religion for as long as modern humans have existed. Although great steps have been made in protecting young women, atrocities happen every minute of each day. And despite these depressing facts, there is hope. This book beautifully and factually proves that women are not the problem, they are the solution. I have all sons, so my nieces are very special to me. Several months ago, one of them was at my house, and she had on a shirt that said, "The future is female." It was bedazzled and sparkly and super cute. At the time, I thought it was a nice saying, and I kind of laughed, but it had no impact on me. After reading this book, I now recognize the weight that statement carries.
This book had a multitude of stories represented throughout it. The majority of the stories took place across Southeast and Central Asia, Central Africa, and in Muslim and Persian countries. Not all of the stories did, which is why we wanted to represent everything that we could. The red pins are where most of the stories took place. Some of the stories were overlapping in location, and some just named the country. Green represents the hospitals that were established because of the brutality against women in those locations. Blue represents the grassroots projects, including schools or donations that have become successful in empowering local women in those communities. These are just some of the representations from those stories. The Democratic Republic of the Congo was known as the rape capital of the world, where roughly 2 million people were raped during their 20-year civil war. That equates to roughly 40 people per day. In 2020, Doctors Without Borders recorded treatment for 10,810 people, or roughly 30 people per day. Liberia has seen little to no improvement in their abuse since 2012. Over 90 people of 3 years and older have been sexually abused. Because of that, it has been declared a national emergency. It's also on the do not travel list for the United States. From the research conducted throughout this book, the most successful way that was found to keep women in school and delaying pregnancy was supplying them with annual uniforms for $6 a person. Although it wouldn't indefinitely delay teenage marriage or pregnancy, they have progressed and now allow women to continue their education while pregnant in most of the countries in Africa. HIV and AIDS was also a leading cause of death in 2012, with over 1 million deaths across the continent. Education about transmission from sugar daddies to young girls and the use of condoms for prevention reduced transmission and has helped with lowering the death rate. Human trafficking across Asia continues to be a huge problem and has a huge magnitude of undetected cases that spans international borders. In China, the estimated cases were 2.9 million in 2012. Today, the estimates span from anywhere between 4 and 10 million, with the most consistent estimate being 6.4 million. Although prostitution is considered illegal in China, there is somewhere between 4 and 6 million sex workers in 2012. Today, estimates continue to range around 6 million, and many of them come from rural villages and are trying to better their lives. China has also started to progress with women's health care, as well as increasing the number of children they're allowed to have. With the one-child law, families would potentially participate in infanticide, sexism, pay fines, and face abuse if they had over one child. In the past 10 years, the number has steadily increased from 1 to 2 and now are allowed 3 children in hopes of increasing their national birth rate. In 2012, the Middle East and South Asia had its eyes on it, with the U.S. in particular with the global war on terror. In Iran, punishment for women often included rape, and it was an easy way to dishonor families. Currently there, women are protesting for their human rights by burning their hijabs, cutting their hair, and standing up for being a woman. For them, the fight is not ending. Comparatively, on the terrorism index by the United Nations Population Fund, Iran and Afghanistan have hardly moved in their ranking and are at the bottom 2 for 2012 and the bottom 10 for 2021. Unfortunately, the Taliban is also currently back in control of Afghanistan as of 2022, where the U.S. was preparing to hand it back to the Afghanistan government in 2012. India has also steadily seen an increase in the number of rapes reported daily and yearly for the last 10 years. It could be due to increased female representation in their country, but also due to an increase in violence against women.
This book focuses on female oppression throughout the world, the ways it occurs, and the effects it has on the individual and communities. A major way oppression is achieved is through gender-based violence. Sex trafficking and forced prostitution are common occurrences and lead to health problems such as HIV, AIDS, and addiction. Sexual violence occurs frequently, with rape being declared a weapon of war by the United Nations in 2008. This type of violence can lead to serious health issues such as rectovaginal fistulas, vesicovaginal fistulas, and incontinence. Lack of access to care, education, unwanted and young pregnancies, and non-existent prenatal care all increase the maternal mortality rate, which in some countries is as high as 1 in 7. Deeply ingrained misogyny and the cultural norm of valuing women less than men results in poorer health outcomes. Rituals and rites of passage lead to harmful practices like genital mutilation, foot binding, child marriages, and honor killings. All of this violence ultimately leads to early death and disability. The authors emphasize that the way to decrease the incidence of these atrocities toward women is through education and empowerment. Educating both men and women and empowering them to stick up for themselves and their family to change the cultural norms that lead to the acceptance of these behaviors and practices. Also, the assistance of social entrepreneurs by providing financial opportunities to build businesses, providing the ability to gain an education, escaping dangerous situations, learning skills, receiving medical care, and changing both culture and laws. Countries where extreme female oppression occur are poor. Keeping women out of schools, the workforce, government, and business leads to lower revenue and contributes to global poverty. Countries that have more women in power result in better allocation of resources, prioritization of community needs, and more money. Although there is initial pushback from communities when women become empowered, it reduces significantly as time goes on and results in culture change. Culture plays an important role in the acceptance and the expectation of these behaviors. Women are taught to believe, spread, and participate in misogynistic values. Many of these behaviors are penalty-free sports for offenders, and laws are sometimes put in place to protect offenders. An example is a law in Ethiopia that states a man cannot be prosecuted for violating a woman he later married. This led to men kidnapping and raping women to force them into marriage. Western influences resulted in laws being put in place in these countries, but changing the legal system without changing the culture results in little change. 15 African countries created a law against female genital mutilation and saw no changes on the ground, in contrast to a Tostan West African group whose tactic was to discuss human rights and health issues related to cutting and then allow groups to make their own decisions. There was great success with this approach, especially when women realized the practice was not universal. Laws can be put in place, but real change occurs when the people change their beliefs and way of thinking. Gender-based violence and sexual violence leads to chronic illness, early death, and disability that is avoidable. Areas where forced prostitution is a cultural norm experience high levels of HIV and AIDS, which leads to early death. Often condoms are not used, and even when practices are put into place to require condoms, customers will pay premiums to go without. Both sexual violence and lack of access to care can lead to lifelong disability that often goes untreated and can lead women to become ostracized and also lead to early death.
This book discusses the health disparities women experienced all around the world. A shocking quote from the book was, "Women are not dying because of untreatable diseases. They are dying because society has yet to make the decision that their lives are worth saving." Disparities were greatly influenced by their culture. The culture was accepting of rape, and the woman was expected to get married to the man afterwards. Also, in their culture, women received less education than men, since the woman was expected to begin having a family. They were expected to get married and have children at a young age. Since these girls were having children very young, the girls experienced pregnancy complications. Their pelvises were not developed enough or the right shape for them to deliver the babies safely. Also, most women did not deliver their babies in a hospital or a healthcare center. The hospitals were far away, and many required the families to pay for the healthcare services up front. Women only received treatment if it was considered really bad. There were a limited number of trained professionals who could perform C-sections or treat patients. An example of the healthcare system from the book is a woman was trying to give birth to her baby in a hospital, but her labor had stopped and she developed an infection. The healthcare team would not provide any treatment for her since her family was unable to pay for her treatment up front. They gossiped about her the entire time and continued to refuse to treat her. Until one day, a group of people from an organization arrived there and donated the money for her treatment. But the trained professional left for that day and refused to come back until the next day. As a result, the baby and mother died. The women in this book experienced disparities which impacted their lives, and for some, it cost them their lives.
The three levels of interventions were implemented all across in different settings in the book. The recurrent primary interventions noted included the measures to teach, train, and empower women and children by several aid groups. Teaching local women to make bricks, textiles, soap, and open shops was a way to build their capacity and skills, which in turn promoted self-reliance, prevented dependence, and gave women the chance for economic independence. Providing basic resources like water, electricity, and bandages by international aid groups were a means to improve the quality of life within these communities. For instance, Alan Rosenfield opened a public health clinic in Nigeria to provide vaccinations, campaigned to urge seatbelt use, and other non-medical solutions like providing school uniforms to keep girls in school longer, therefore reducing early pregnancies. The CAR Foundation, a microfinance organization, loaned exclusively to women in groups of 25 who guaranteed one another's debt. The Center for Global Development worked to reduce global poverty through innovative economic research that drives better policy and practice by decision makers. Secondary interventions included surveillance centers where shelter, counseling, and safety were provided for victims of sex trafficking and domestic violence. Volunteers would disguise themselves to go into brothels to make direct contact with victims forced into prostitution and paid for their release if possible. Local women were trained as midwives and provided C-section kits to support their communities. Aid groups would fund the cost of transportation and delivery for pregnant women who could not afford to deliver safely at the clinic or the hospital. Edna Aden Maternity Hospital provided maternity care in Somaliland for disadvantaged women. Tertiary interventions noted included the Heal Africa Project, a successful hospital where all but 3 employees were Congolese to support local communities in Congo. Women treated were trained and became partners in the hospital and later would train new workers. The Addis Ababa Fistula Hospital was run by Catherine Hamlin, an Australian who administered over 25,000 surgeries. The American Assistance for Cambodia fought trafficking and now has a program to subsidize tuition for poor girls so that they remain in school. New Light is an organization to assist prostitutes and their children with disease treatment in Kolkata, India.
The overall goal for the future is to create a female emancipation and/or empowerment movement. After all, women hold up half the sky. For this movement to be a success, it must cross all political lines. We must be honest and not oversell the idea. We must include men. We must all become more aware of global repression and the cultural implications of such, and we must be flexible as we move to help make the world better.
There are many different goals for the future that help shape our vision. Unfortunately, there is no perfect world, but there are ways that we can help right the current injustices present within our own. As you have learned, there is a large gender gap in education, and we know after this semester that education is one of the biggest barriers to quality care. If we can reduce that gap, we may be able to help people live happier and healthier lives. One of the ways to help do this is to utilize microfinance and assure that women hold the money, as when they do, it leads to healthier children and families as a whole. The gender gap is mostly found in Africa, but also Asian countries, as well as Afghanistan and Pakistan. It is estimated to cost roughly $10 billion to overcome this issue by providing uniforms, scholarships, and helping manage female menstruation. Next, we must iodize salt in poor countries. This small factor leads to a loss of 10 IQ points per infant affected. This project is expected to cost $19 million, which in comparison is a cheap, simple, and highly cost-effective method to improve the lives of many. Third, you heard us talking about obstetric fistulas and how simple it could be to eradicate the issue. This would cost us $1.6 billion to make this happen by creating 40 fistula centers throughout Africa to decrease maternal mortality. Finally, we want to decrease sexual violence and sex trafficking. We have learned that the single most effective way to do this is to educate people, especially women, but also the boys and men, on how the way that they treat women can affect them and their lives, as well as their children in the future. Another way would be to involve women in politics and leadership roles. Leadership needs to come from the developing world itself rather than outside countries. Empowering women is part of this answer, and bringing girls into the formal economy can ease some of their frustrations. Even Fortune 500 companies in America shows the impact that women can have, with 25% having women outperforming those that do not have any women.
After reading this book, we chose to take it one step further and be part of the change. I do not have time to delve too deep into this organization, but I urge you to click on the link and learn more about them and other projects like them and see how you can make a difference.
Education opens the mind and results in change. It enables women to face challenges, confront their traditional or cultural roles, and change their life. As nurses, we must provide education even if it seems obvious.
Being able to understand culture, even when it differs from my beliefs, is very important whenever we are educating patients. We need to be able to be non-judgmental and provide unbiased education to our patients.
In many countries, female chastity is valued highly, but a woman's value is not solely in her chastity. The idea of protecting the good girls by using prostitutes must change. In my nursing practice, I will not judge patients or jump to conclusions based on their occupation or sexual preferences. I recognize the importance of female sexual health and embrace their reproductive rights.
These stories have opened my eyes to the power empowering women to believe in themselves and teaching them skills needed to become self-sufficient have. At Heal Africa, a hospital in the Congo dedicated to fixing fistulas, a skills training program has been created. Here, women awaiting surgery are taught how to sew, read, weave baskets, make soap, and bake bread. Providing this resource transforms these women's lives. In my future practice, I will make sure to look up resources that are available to empower women and enable them to support themselves and their family.
Throughout this book, I was learning how to recognize that some of these cultural practices are continuing to go on, and we need to be able to recognize and provide appropriate care and education so that as some of these people come to our country, we can provide appropriate care and education and be able to advocate for future generations in our country to provide the appropriate care for them.
This book has made me realize the impact that simple things like studying abroad and/or working abroad to provide healthcare can have. I have learned that there are ways to help modernize the treatment that patients are receiving, and by doing so, make a significant impact on the country. By studying and/or working abroad, you can learn and empower yourself, and by empowering yourself, you can empower others and grow a culture.